I'll introduce myself. I'm Michael Sudbury from Myofascial Release of Salt Lake. DBA also Release Works. It's a myofascial release therapy clinic that I have been running now since about 2008. And it's been just me, but I'm now looking to grow and expand and turn it into a full clinic. And I've helped people recover from injuries and chronic pains and ailments that have plagued them for years. Both avoiding surgery, recovering from surgery, and all sorts of things, including a gentleman on permanent disability. He's now starting to think, hey, I can go play hockey again. It's a process sometimes, but we can reverse a lot of these things. So that's me, that's what I've been doing. The reason I'm here at the birth center is because, I forget the time frame, maybe about 10 years ago, my wife sprained her back really bad. Just in the normal course of work, moving things around, not an accident, not an injury. Well, I mean, I guess it was an injury, but it wasn't an event that you would think. Normal course of work, sprained her back, went to go see a chiropractor, and upon evaluation, he told her, do not ever get pregnant.
Wow.
Mm-hmm. He saw that her pelvis was so far upslipped, twisted, and tilted that pregnancy would be incredibly difficult, both carrying and delivery, and don't do it. And that there wasn't a whole lot he could do to change it. This was just about the time I was starting my journey as a therapist. So eventually, I started looking at and treating my wife, of course practicing on her all the time, and I started assessing her pelvis. And when I saw myself how twisted her pelvis was, I'm like, oh, no wonder, because it was seriously bad. I mean, we talk about upslip and twisted, so that this point was 1.5 inches lower than this point. And that's after it went higher. It was quite a discrepancy. No wonder her back hurt. No wonder she couldn't sit even a year or two later. She could not sit, even with a pillow, for more than 5 minutes without having to go, oh, my back, and go lie down and try and stretch it out. Every time. So after some treating, after her pelvis started changing and realigning, we've now, at this birth center, had 3 kids, no medications, no epidurals, natural delivery.
Nice.
And wasn't as smooth sailing as you might hope, but far, far better than the chiropractor would have suggested. And she's actually able to sit. She's definitely been recovering. I'd love to say that she's recovered further, but we have kids. When do we treat? They take up all the time. So that's how I'm here. We had a fantastic experience, and I'm just so pleased that we were able to change that for her and make it even possible to begin with. So that being my background with pregnancy, the thing going on is that the fascial system, tissue of the body, has been largely ignored, overlooked and ignored in healthcare. It was studied in cadavers, and cadavers are dry and brittle. So there was not a good sense of what the fascial tissue is or what it does. It was mostly cut out of the way to look at the interesting stuff. And the fact that the fascial tissue is the architecture for every structure, every system in the body was completely missed. But it turns out that the fascial system, or more properly the myofascial system, is the immediate environment of every cell and is the architecture, shaping, support, containment, division of everything in your body. It is the largest system of all. It's the fundamental system. And as such, it has profound influence on everything. Nervous system, circulatory flow, organ behavior, muscle movement, joint action, all of those things. And even if that has been noticed at all by some medical professionals, they haven't known what to do with it when there's a problem. Their best response has been, oh, hey, let's cut it, or let's laser it out of the way. And that, of course, is injury. So that brings me to injury to the fascial system. When there is a force into the system, when there's a chronic long-term holding stress, in the system. The fascial tissue, which is a bunch of fibers that move, and fluid that they're bathed in, that will gel, set, solidify, and harden, and stop movement. That is a proper injury response that helps prevent that area from being damaged farther and allows for recovery. But what doesn't happen in our society is we don't recover from that. We stay hardened to a large degree, and we miss it. And so now we have tissue that should be able to move like this, cannot move. And so, just like the fabric here in my shirt, it creates a distortion in my structure. Completely continuous web from here to there, large to small, in to out. And it is being pulled, twisted, and not moving in some areas, and it's causing distortion. Now, this is not where people feel pain. This is where people feel pain. Where the disc is being crushed, the nerve is being pinched, the rib is being pulled out of place. This is where people start feeling pain, where their neck is twisted. And everybody treats these spots. They rub those spots, they medicate those spots, they cut those spots. They are simply the spots that are being overwhelmed. The problem is the fascial restriction that happened due to injury a long time ago. Once you release that, the system can recover, can rebalance, skeletal alignment can come back to what it should be, and we recover. That's the general public approach, our explanation for everything. That has great relevance for pregnant women, because not only do they have this going on in their bodies, they now have to deal with an adaptation to a growing being in there. They have to allow more room and shifts and changes and everything that we just boggle at, and they can't do it if they're twisted and scrunched and crushed. How do you fit a growing baby in there? And how do you get that out safely and easily if things are twisted? Oh, and I was mentioning it to you earlier before, I think, well, we were recording, but who knows how much of that will show. Pelvises will get pulled and twisted out of alignment. They're supposed to be able to move and flex a little bit to allow the baby's head to enter and then exit the pelvis. But if you are slipped and twisted, that movement doesn't happen, and the kid has to squeeze through as best they can. No wonder we end up with C-sections, or with birth injuries and forceps and all of that. So by releasing the fascial tissue and restoring alignment and move and mobility to the tissues and the system, pregnancy becomes much easier than it's been. All the other issues too, like heartburn, reflux, morning sickness, back pain, all readily explained by pressure on nerves, immobility of muscle tissue and joints, pressure on discs and nerves that are being shifted out of place and pinched. Realign the system and all of that can be addressed and relieved. So that's the basic idea. Any questions at the moment? Any insights? Jump in, ahas, woos?
Sounds good.
Sounds good.
Yeah.
All right. So I don't want to spend a whole lot of time on the explanation because there's not much more to say. It's actually that simple. Science has not been very involved in fascial research previously, but the past decade or two, they've become very, very interested. It's largely been an experience sort of explanation. This is what we think is happening, but our experience has been myofascial release really, really helps issues. Now the scientists and the researchers are interested and are involved. There have been, I think, 5 international congresses on fascia, and that happens every 3 or 4 years. And they're very, very excited about what's happening, and they're backing up everything that our experience has been telling us about fascia. That being things like the fascia, let me back up. I mentioned the fluid. Let's go back and go a little bit further. So I hope you can see this pretty well. This is,
Oh, it changed.
it changed, awesome. Okay, thank you. So this is a strand of fascia attaching into the substrate around it. And we have basically 2 types of fibers in fascia, that being elastin and collagen. Elastin stretches, collagen does not. And together they provide shaping and support for everything. But here we have it relaxed and here we have it kind of stretched out. Now, just like I demonstrated with my shirt, it's one continuous structure, and when there is a pull and a twist in one spot, that will spread throughout, just like it will in a sweater, causing distortion and problems everywhere throughout. If you want to get a good sense of fascia, start peeling apart a grapefruit. The fascial tissue, connective tissue, is the white stuff, as well as the membrane that separates those segments. And if you peel apart those segments even more, it's the membranes that start making the pulpy bits even. Large to small, in to out. It's all fascia, specialized for its role. When it gets tight, just like a Chinese finger trap, anything in there is getting squeezed. If you want to picture a muscle, everybody will say fascia. Oh, isn't that the tendon or the ligament or the wrapping around the muscle? And yes, it is. But what we're talking about when we say fascia or myofascial tissue or connective tissue, it is also the parts separating the muscle into smaller bundles and into smaller fibers and into the muscle cell itself. It's even been shown that the fascial system interfaces with the cellular membrane to interact with the cytoskeleton internal cellular fascial system and influence what genes get expressed from the nucleus. Injured here. Throughout time, it spreads and starts pulling and affecting down his leg, up his arm, and into his neck. He starts complaining of headaches, or carpal tunnel pain, or sciatica, or plantar fasciitis. But the source was there. And everybody's treating the symptom. Nerve, blood vessel, caught within traumatized fascia, restricted. It's going to be constricted, pinched, pulled. That nerve isn't going to glide as well, and you're going to have symptoms of protection all the way around that. That is an actual picture of tensed fascia, tissue. You can see the striations of strain in there.
Looks like it should be an art picture, modern art.
Yeah. Part of what's happening is that the fibers that interact and should move across each other, they stop moving for a while and crosslinks form. So now fibers that should glide do not glide. And you get a snag. And that happens in multiple places and builds up. One fiber, one crosslink isn't a big deal, but thousands of them, and you can't move there. Most of the fascia in the human body is organized vertically, up and down. But there are major transverse sections at the pelvic floor, respiratory diaphragm, thoracic outlet, and cranial base, as well as at each joint. When those get twisted and pulled, structures get misaligned, organs get pulled. Pelvic base, nothing important in there. Lots of nerves, reproductive organs, bladder, incontinence issues. Respiratory diaphragm, we also have a few more things. The aorta, the vagus nerve. The vagus nerve is responsible for innervating most of your organs, and if it's being pulled, it can cause problems with your endocrine system, the behavior, maybe I shouldn't have said that one, but the other organs and how they function, pancreas and all that kind of stuff, as well as it tends to cause nausea and balance issues. Your lungs, heart, their behavior is all affected by fascial restrictions, thoracic outlet syndrome, lymph flow, all the stuff happening there. Your shoulder girdle, this is looking down on top of somebody's shoulders. That gets twisted, that gets compressed and impinged. And you start having problems through there as well, including stuff like thyroid issues. Cranial base, if that's out of alignment, you're going to have headaches, migraines, palsies, tinnitus, jaw pain. Here's one of my favorites. Start, if you can see that. There's that right there. And you can see how the skeletal structure has been misaligned, pulled out of alignment by fascial restrictions. And they all come into patterns of compensation and holding, so that you end up like this person with a bit of a scoliosis. Ask city people what holds up a tent. Most of them will say the poles. But if you don't have the tension right on the strings and in the fabric, that tent isn't staying up. I like to have people picture a tent. Now imagine one side had a slice in it. And now in order to repair that slice, you overlap the fabric and stitch it together. What's that going to do to the shape of the tent?
It's going to completely change it.
It's going to completely change the shape of the tent. It's going to do this towards that side. Where's the tent going to start failing now? On the other side. Seams are going to burst. Poles are going to get bent. Symptoms. Look familiar? Anybody's posture, you know? The pelvis gets tilted. The spine has to compensate and adapt, and you end up with this sort of a shape. This was, I believe, an 18-year-old girl. She'd taken a fall from a horse onto her sacrum, and that was her before they went and saw teachers of this approach, my teacher, and received just a few treatments where they balanced her pelvis. This was after. This is not years difference, this is about 3 days difference. Again, injured here, the effects spread throughout the body. So, I was going to briefly speak, before my slides distracted me. Those fibers are all moving in a continuous fractal network, and they are in a fluid. If you want to see this, YouTube strolling under the skin. Take a look at that, and you'll be able to see all of these fibers moving. That was done by a French hand surgeon who started noticing, wait, the tissue doesn't behave like they told us in the textbooks. And he started getting curious. And that's actually part of the problem, is the medical textbooks are still teaching things that have even been shown incorrect over 80 years ago. They still teach, for example, that the fascial system is a insulator to electrical energy. And it is in a cadaver. That's because the water has been removed. But in a living human being, the fascial system is actually a semiconductor, which sets up all sorts of interesting ideas because semiconductors are responsible for computers, energy, movement, information storage, transmission, processing, all that kind of stuff. It starts turning our fascial system into what we call a liquid crystal matrix, capable of storing and processing information, which might blow your mind. That's not even what we're getting into, but it sets up all sorts of intriguing possibilities. But let me step back. So those fibers are in a matrix. Scaffolding, webbing, all that sort of thing. A weave, even, if you will. And they are supposed to move and flex. And you can see this if you look up that strolling under the skin video. You can see that. It's very fascinating. Change the way you see the body. What that video leaves out, what that video misses, because he made an incision, lifted up, stuck a camera under there that magnified. So he's getting fascial tissue in air. There is also liquid in there, what we call the ground substance, a fluid component. This is what we refer to as the interstitial spaces, and this is the medium and direct environment in which all cells live. That fluid, the ground substance, is filled with proteins that are the very same proteins we get gelatin from. That's where we get gelatin from connective tissue. And they do the very same thing when you mix it up in hot water and put it in the fridge, they set. That's what happens in an injured inflammatory state, is the ground substance sets and hardens. All the fibers in there don't move. Now, that's also what we refer to as scar tissue, fibrotic tissue, all that kind of stuff when it gets that far. But that's the normal inflammatory response. So that sets up what we call restrictions, and derailed a little bit. That sets up restrictions, and that's a normal response to injury, and that's good. What doesn't happen is we don't unstick that. We don't recover from that. We leave that alone. We kind of favor it for too long. It gets stiffer and it gets worse, and then we try and move it and go, oh, hey, it doesn't work the way it used to anymore. Okay, and it causes pains and problems in years down the road. And those are the spots that we notice. There are other spots we don't notice. Like we sit all day like this, and we get stiffened and restricted in there, and we stand up, and we don't quite go back the same way, and we hardly notice. We'll eventually notice the back pain it causes, but we don't notice the limitation here. Hardly anybody's aware of the restrictions here, and almost everybody has it. So, they are recoverable. And the approach is simply to put pressure, sustained pressure into that. There are other styles of myofascial release that do basically what we call substitution mobilization. This is the run an elbow through. This is the break it up. You may have seen a thing called the fascial blaster. It's all about grinding up the tissue. That is aggression. That is force. You're trying to force a system that doesn't like to be forced, and all you'll do is injure it. You'll get some temporary results that way, but that's the thing, is they'll be temporary because your body will heal that back up the way it was before, even thicker and tighter. So, not the best approach. But if you put a sustained pressure into the tissue with awareness, because the tissue starts changing and responding to that pressure and essentially melting. And as you follow that, you can release that solidified tissue. The fibers start moving again, body starts aligning again, it recovers and heals itself. Okay. That's what I'm here to start showing too. And how do we apply that then to pregnant women? Now, everybody here is a therapist, I think.
Craniosacral therapist and visceral therapist.
Mm-hmm.
I'm not a licensed massage therapist.
Excited to
I'm
hear
the
what you do
outcast
though.
today.
I'd love to talk to you about your visceral stuff.
She's amazing.
My point had been to talk directly to women who were pregnant and wanting to have an easier, more comfortable pregnancy. So that's still the tack I'm going to take because that's who this is recorded for. But this will also
I have a
be
grandbaby
applicable.
coming. I would love to have more education to help.
Of course, of course.
I have a doing plan. I want to help her, so. Okay.
So we don't have anybody who's actually pregnant to work with as a model or a demonstration, but what I would like to hear now is what are some of the issues that you personally have experienced or your friends have experienced, if not you? Anybody who wants to speak up?
During pregnancy?
Pregnancy issues.
I think all the clients that I see who are pregnant oftentimes will complain of hip pain, shoulder pain because they feel like there's a lot of weight pulling from the front, swollen ankles, of course just like the tiredness and fluid retention and swollen hands, things like that.
Do you feel that the microphone is picking that up?
I think so, yeah.
Okay, then I won't try to repeat that.
Will providing myofascial for women who are pregnant, opening up spaces and places of restriction, will that help babies that seem to be having a difficult time positioning themselves correctly?
Absolutely.
Great, then I would be interested in helping my moms with that.
Yes, of course. When the spine and pelvis are twisted and compressed or misaligned, the rib cage gets stiffened and compressed, there's less room in there. When the tissues inside are stiffer and can't move as well, there's again less room in there. So you help release that, help things move again, and of course it's easier for the baby to position. I've got a handout. On the other side, which is mostly experiences from colleagues of mine. I found the way they put it very helpful and would give a different perspective. So one of them even mentions that. So pick that up and look through that. You were going to ask?
Well, you mentioned that it can even affect things like heartburn. Like I have a friend that gets
Mhm.
very nauseated even in the third trimester and has a hard time eating anything. You know, can it help with things like that?
Absolutely. Again, picture lack of space. That means increased pressure. That means more pressure back up. But also, the stomach And the valves are fascial structures, and they're subject to twisting and pulling and misshaping. And valves don't work so well when they're misshaped and pulled. They can't fully close. So you've got both of those issues that can be helped, and you'll have much less reflux.
I would imagine, you know, and as I've listened to all my friends throughout the years, as well as my own experience with having passed a child through there, bladder issues afterwards are probably really prominent.
Mm-hmm. Mm-hmm. Yes. Again, when the pelvis is twisted, that's going to put both slackness on again, valves, slackness on the pelvic floor, as well as tightness in other places on the pelvic floor. Plus, again, the bladder is a fascial structure as well, and is just as subject to solidification with extra stresses on it. So it itself can lose capacity. All of this can be affected. Some of it may require internal myofascial release, and that is very, very helpful. Everybody needs that. A lot can be done even without internal MFR. But balance the pelvis, and many of these issues will resolve. Mm-hmm.
My daughter, she's pregnant, and she's a geriatric pregnancy, meaning she's 36.
Is that geriatric?
That's just so sad.
I know, she about
What?
died when she told me that she's considered geriatric.
That was my wife with our third.
And, well, it's her third, and, so would this help with like some of the concerns that they have, like, they told her if she, you know, she doesn't feel the baby move every day, she needs to go right in.
Mm-hmm.
And she's had 2 very healthy pregnancies. You know, last one was 7 years ago, but
So speak to me of these concerns.
they just got her all worried, like if she doesn't feel the baby move, she needs to go right in.
Right.
Well, none of her kids were very active, this one included. She's had a lot of heartburn, but she had that with the others, you know, a lot of nausea.
Okay, so what I'm hearing is she's not having any particular issues that are concerning other than the doctor's passing on concern.
Right.
Okay. Well, I can't help with the doctors.
Granted.
But yes, we have this idea that age, the number, is the relevant factor, and it's not. That is not the factor at all. The fact that you're 35, 36, 40, 45, whatever, that alone is not the thing that makes you stiffer and have all these issues. Restricted fascia is, misalignments are. So as your organs get pulled and twisted and solidified for a longer time, you have more and more issues, of course. Start reversing that, your body will feel and behave as if you're younger. You'll even start looking younger. So yeah, you won't have those age-related issues. Now, if she's still worried about that, we might just have to, hey, what's up with that? But, yeah.
I have a question about the internal myofascial release stuff, which
I'm sorry. Oh, you're interested in internal, okay. I didn't quite track all of your syllables.
Sorry.
I'm with you now.
Sorry. I mumble. Okay, so not necessarily to do with pregnancy, but infertility, which is kind of leading up that alley. For women who might have infertility issues, could some of that be from like just fascial stuff, like pulling things in all kinds of directions that aren't making them function? So I can help.
Mm-hmm.
Awesome. Thanks.
Yes, in fact, women will talk about how they feel things being pulled and twisted, especially on their menstrual cycle. They'll feel these pressures and pains, and they'll describe them to doctors who basically, oh, it's just a woman's issue. And they kind of don't believe it. Or if they do believe it, we can't do a thing about it. Those are actually fascial issues. Again, twisted, it's going to cause areas of slackness and tension pulled through the organs. If there has been any kind of impact or chronic holding, which everybody has had, then there's going to be a line of fascial restriction in through there as well. And if you hear of fibrotic tissue, adhesions, all that kind of stuff, those are fascial issues, and they can be affected. So yes, if it's there are multiple factors by which this could work, and I couldn't say that we can help all causes for infertility.
Of course.
But for example, if the fallopian tubes are a little bit twisted and rigidified and they don't receive that egg from the ovaries quite as well, very much that can be helped.
Okay.
And things like, what's the word? Endometriosis. Again, basically a fascial issue. All that kind of stuff can be helped. The difficult menstrual cycles, cramping, all that kind of stuff can be improved. So yeah, this is relevant for everybody, and there have been occasions, I couldn't cite any numbers on it, but I do know that women who have had trouble conceiving have become able to.
Cool. Awesome.
Okay. So,
I do a service called an intimate steaming, because I'm also a master aromatherapist. And I had a couple of clients that were infertile, and between the craniosacral work, the visceral work, also I'm a Reiki master, double certified with that, and the intimate steaming, and I do an Ayurvedic massage as well. Within a couple of months they conceived.
Yeah, awesome.
So I think there's probably a whole lot more in that fascial area that really causes those imbalances.
I'm just curious what the process of therapy looks like.
we're gonna get
Wait,
to that.
okay.
We're gonna get to that after these questions, but I wanted to make sure we turned it to pregnancy issues. But when you speak also of hormones, the endocrine system is also contained within the fascial system. And every endocrine organ can be affected and influenced. But let's talk about the master control one up here. And I always forget whether it's pituitary or pineal. Pituitary, thank you. I knew somebody would know. It hangs from a stalk inside the sphenoid bone of the cranial base, cranial structure. And the cranial structure is supposed to have a rocking motion which milks that gland. Now, if the fascial system has been pulled and twisted, then that bone movement gets jammed and is dysfunctional, and that organ is no longer being milked effectively. So right there you have a mechanism by which you can improve hormones,
That's interesting.
which again, another venue, another vector towards infertility and improving it,
Awesome.
as well as all those other issues. Okay, so what I'd like is somebody who's going to be a demo model. Come on up.
I'll do it. Yes. Sorry. Hi.
Hi. So, do you mind flipping the shoes off?
Nope.
What's our field of camera? I'm okay to move through here?
Yeah,
Or
I've
you'll
got-
follow me?
yeah.
Okay. All right. So let's talk specifically you, since we're not dealing pregnancy, but what
Okay.
kinds of issues do you experience?
I have some restrictions in my neck and shoulders, so all the tissue at the back of my occiput is like super tight. I have a really hard time releasing that.
Mm-hmm.
And my endocrine system is wildly messed up.
Okay.
So-
Okay.
For the people who are going to be watching this on video, do you think you could take a 5-minute kind of a wrap up, give all of your contact information so that they can reach you?
Are we at that time
Video.
already?
Well, we've got about 10 minutes, but I'd like you to wrap it up and give that information so we can, and then all the questions and details that you can give people after that would be great.
Okay. Well, I didn't get to demonstrate there for the people on video, but you can find me at mfrofsaltlake.com, which is also myofascial release of saltlake.com, 801-449-0594, and we'd love to help you out with any type of pregnancy issues you're having. Please just even get in touch for questions.
Name.
My name, Michael Sudbury. Thank you. Release Works, Myofascial Therapy, and I would like to get just a little bit of a sense of how this works, because like I mentioned, sustained traction, sustained pressure into the system, and those tissues start melting and becoming able to move again, structures become aligning, taking the pressure off, giving you more movement and mobility, and letting your body heal and recover. You'll feel much better, and all of what your body is trying to do for pregnancy will become much easier and more doable. That also factors into delivery. Imagine, again, if things are twisted and limited, then delivery becomes much harder than it should be. Okay, so let me have you do this. So do you mind taking off this top?
This is connected,
Oh,
sorry.
it's connected. Okay, so what I wanted to point out is you've got some of the typical this going on. Okay? So then what I would start with, let me have you lie on the table.
Okay.
On your back, face up, head over that way.
Okay.
And after checking for some obvious visual distortions, as well as hearing what her history has been and feeling what's going on, I just introduce a gentle traction. You'll hear a lot, if you've looked at myofascial release, a lot about rubbing and grinding and rolling out, and that's the aggressive soft tissue mobilization we were talking about. That gives some good results, but generally they're limited and can even come back worse. But with this traction, I'm feeling up into her sacrum and low back. I can feel she's very pulled this way.
Like, I so want to like lift my head and look.
Sway back.
What? Okay. thank
Sway
you.
back. And as I hold this, the time frame is important. People try to stretch. They try to do this idea where they free up the tissues, but stretching, the way we've learned it, not very effective. You'll get a muscle relaxation at best, and that lasts for about 2 hours. And what people are doing when they stretch is they try to push further into the limited range for about 10 seconds. Like, oh, okay, good, that feels good. That does feel better. Like I said, it lasts about 2 hours. Instead, I feel for where her body cannot move, and I give a lengthening. And that introduces a traction, well, I use the word pressure. It works either in or out. Sometimes I compress, sometimes I traction. And then I wait, because that tissue has to go through a phase change of, it's not exactly melting, it's not technically melting, but it's very similar. That fluid component is becoming more able to move. Those fibers are responding to that, and then the bony structure will also open up. And you'll start to feel little shifts and changes. At some point, maybe not in any particular one hold because it all adds up, but at some point those bones will start adjusting back into place. The muscle tissues will become more able to move and the pains will start going away. How does that feel?
Feels good.
Would this be the same on a pregnant person?
You have to respond to every person, of course, and whether they can lie on their back or not, you might have to get creative. But yeah, the main difference with pregnant women is you don't put any pressure into their belly. But as that tissue changes, yeah, she's so bound in her low back.
How many treatments would it take to correct something like
That is an impossible question to
that?
ask.
Okay.
Or sorry, answer. Everybody asks it. Partly, we've got this idea that low back pain is low back pain, and that's not true at all. Everybody has their unique history of what has happened, how they've held, how they've responded. Everybody's history is unique, and it all adds up to low back pain, or shoulder pain, or neck pain, or whatever. So everybody's situation is different. Nobody's pattern of fascial restrictions is the same, and people don't respond the same. Usually, people can feel a difference. They can feel a relief in 1 or 2 sessions. They can feel something changing. They can tell this is important. They've approached that they've been missing. Full resolution, impossible to say.
In your practice, do you also, or are there available things that they can do at home?
Absolutely. Fascial release, myofascial release is something that really should be a self-care practice, and probably there wouldn't be a need for therapists if we had been doing that. But this is like the maintenance for your car. You haven't been doing it for years. Your engine's seizing up. The tires are, blown out. You need you've got a lot of backed up problems. So by the time people get to me, they've got years of backlog. It takes a while to get through that, and they're generally not very capable of self-care at first until they start having some experience and some help, and then they start feeling the difference. Then they can become very effective at self-treatment, and I highly encourage that. They'll get much better results that way if they're treating themselves when they're not seeing me. I one time had somebody who was an hour and a half drive away who really focused on that. So she actually only came and saw me, I think, twice. And a couple months later told me about how she'd been working 40 to 60 minutes of self-care every other day. And she gave me a whole list of things that had helped herself, including a cyst in her hand having disappeared.
That's cool.
Her breathing had improved. What are we pointing out?
The release on that left hip.
Yeah. You're seeing it move better?
I see energy, so I just watched the whole energy unwind in.
Yeah, some
And-
people
and
are
asked
visual
her
and
if
can see
she had
that.
seen it. I'm trying to help her develop that.
Cool, cool. And that will happen too. Fluid flows, energetic flows will all improve. In fact, if you talk about things like acupuncture and meridians and chakras, there's good reason to believe that the fascial system is the container of those energies. And when it's bound up and restricted, that energy is distorted and messed with, doesn't flow as well. So with release, again, all of that will improve.